Welcome to a new episode of our podcast, Eurohealth. Our guest today is Miss Iga Jeziorska. Did I pronounce it well?
Yes, thank you.
Thank you. She's Deputy Director of Youth Organization for Drug Action, YODA, abbreviated, and she's also involved with a civil society forum on drugs in the EU. Which is expert group to the European Commission. She studied in Poland and in 2013 moved to Hungary, and she's currently a PhD candidate at the Institute of Economics and Public Policy of the Corvinus University of Budapest. Welcome.
Correct. Thank you very much.
My name is Jan Klosáček, and obviously my first question is, what brings you to Prague?
Well, I came for the 5th European Harm Reduction Conference that started officially yesterday with an opening session in the afternoon. So I'm one of the probably around 200 participants at this conference, which brings together harm reduction professionals and academics from all over Europe and beyond.
Mm-hmm. Great. So you are involved in the area of youth and drug policy. I'm a parent. I have kids 9 and 11, and obviously I would prefer my kids to never learn anything about the existence of drugs. And well, okay, the first glass of wine could be at around 30 years old or something like that. But I still remember my youth, and I know that it's not quite possible. Do you think that even for children, the harm reduction policy is applicable?
I think that harm reduction policy goes well beyond only substance use. When we talk about harm reduction, we very often only limit it to kind of behaviors, activities that are socially perceived as very risky. But if you think about it, and in the context especially of children and substances, so you said the first glass of wine, but what about sugar? What about caffeine? So coffee, basically. What you do with the harm reduction is that you don't allow your children to eat only sweets all day, right? Yeah. This is also harm reduction. Mm-hmm. When we think about kind of everyday activities, we implement harm reduction measures, not even thinking about it. I'm talking, for example, seat belts in cars. Mm-hmm. I'm talking about the helmets when you ride a bicycle or motorcycle. I'm talking about taking or putting on a glove or a mitten when you take something out from the oven, right? So these activities all aim to reduce harms that stem from the activities that we are undertaking. Yes, so. I think that for everyone, and everyone practices harm reduction in everyday life. And in that context also, yes, it is applicable to children, it is applicable to youth, because simply we want to enjoy different activities in life with the lowest possible risks involved, and that's it.
Yeah, sure. And the question is, does it apply also for non-substance abuse, like overuse of computer games and watching YouTube all the time, etc.? Is there some border where there is it's preferable to ban it all, or to limit it to zero? How for a parent to find the proper balance, what is acceptable, enjoyable? When I was a kid, I was able to spend 12 hours a day watching TV, and then came computer games, and it changed a lot. But we want to protect our children, and yes. Where and how to find the proper limit.
Well, that's probably very tricky, because this is a quite important and quite challenging trade-off, I would say, because there are research regarding, for example, how many hours a child of certain age should be allowed in the front of a smartphone or monitor, any kind of monitor, right? I think it's up to 1.5 hours, if I'm not mistaken, at the age of 8, 9, which is completely realistic, in fact, in today's time. So we have this challenging trade-off also between protecting the rights or appropriate proper development in physical and emotional terms of children. On the other hand, we have digital literacy, right? So on the other hand, we cannot kind of prevent our children from not being familiar with these devices because they are everywhere, and if we limit them very much, it may result in kind of exclusion from the peer group, but also maybe difficulties in learning at a later stage if these kind of devices are used. I believe that it is also up to individual parents how to find this balance. Probably this kind of decisions should be informed ideally by reviewing some sources regarding that. I don't have specific numbers from the top of my head, but
and I guess for every kid it might be a bit different.
For every age, I would say that would be a little bit different, but yeah, we are, even adults, spending more time in the front of screens and in the sitting position more than we should actually for kind of healthy development and maintaining healthy body and organism. So yeah, children should be probably encouraged to do more sports, to be outside more. But it's difficult, especially when we talk about, for example, COVID pandemic and the situation when everybody was closed at home, and online communication was basically the only channel how you could maintain your relationships with your friends or classmates. So yeah, definitely a tricky thing to do, but I believe that parents, I guess I don't have children, but I guess that parents having the best of their child in mind, I do want to believe that they can make a right decision regarding what the limits are. Yeah.
I usually try to avoid discussing too much about the pandemics because it's everywhere, and there is more to healthcare policy then. But obviously, I cannot skip the question: how was addiction policy influenced by the pandemic? So do you think it was put on the back burner, or is it now even more important than before?
Oh, that's a very good question. I mean, when we talk about the region, for example, here in Central Eastern Europe, but also in other countries, so drug policy has been never a priority to policymakers. So it's a topic that sometimes kind of pops up, especially when there is a need for kind of finding some topic that will kind of catch the media attention, some kind of topic that replaces something else that the government maybe doesn't want to talk about too much. But in terms of policy implementation, in terms of real actions, it has been never a priority. It's a controversial topic, not very well perceived in the society. Obviously, for politicians, for policymakers, it is way more beneficial if, for example, during the campaign they photograph themselves with children or other disadvantaged or vulnerable groups, which are not as controversial as people who use drugs. So how it changed during the pandemic? Harm reduction services have been operating still in many countries. This was very difficult because many of clients of those services are people who experience or live in homelessness. So for them, stay at home and isolate yourself was just not possible. What happened was that some changes, in some countries, some changes have happened in a way that the regulations have been relaxed or lifted, and some more flexibility was allowed for the services. something that was not possible without the pandemic. So, for example, there is kind of service that provides a substitution treatment. Okay, so for people who use opioids, they provide a substitution substance. That is less harmful than street heroin, right? And in many countries, these services are very strictly regulated, and the policies are that people can have to go there every single day to get their dose. Due to COVID pandemic and the lockdown measures in some of the countries, the government allowed for taking this medicine home for several weeks, for example. Yeah, so some kind of small, very tiny changes have happened in certain countries that kind of allowed for more relaxed or flexible functioning of different services. I know also of organizations, I think it was Germany, again, if I'm not mistaken, that, for example, when they couldn't provide clean needles to their clients, they send them via post, so in letters, basically. So very many innovative interventions, but this is rather civil society organizations which provide services. With respect to policy, this kind of tiny changes that allowed maybe a little bit more flexibility in services. But I hope that in long term there will be changes in policy, because I think that this situation, the lockdown measures, showed also how important it is to take proper care of mental health. And mental health is very closely related to substance use. Of course,
Obviously.
very many people who use substances in a kind of risky way, they just try to cope with some underlying mental health challenges that they experienced. So, and during the lockdown measures, the mental health deteriorated in general population and among youth as well. And I hope that it will help kind of policymakers realize that this is something that needs to be taken care of.
Okay, you are based in Hungary, but originally from Poland. So, how do you consider those two countries dealing with addiction policy? Both the governments are considered at EU level, let's say, to be somewhat troublesome and much more conservative than the rest. Does it apply even in this area?
Absolutely.
Yeah.
Absolutely, yes, especially in case of Hungary, where drug policy changed drastically in 2000. It started from 2010, but since 2013 even more. So Hungary in 2013 adopted a drug strategy that ended last year, actually, in 2020, and the title of this drug strategy was Clear Consciousness, Sobriety, and the Fight Against Drug Crime, more or less. And the main goal of it, one of the main goals of this strategy, was to achieve drug-free Hungary by 2020. Which obviously,
did it succeed?
There is no new drug strategy in Hungary since 2020. So I guess that I assume that they succeeded. Yes, but no, it doesn't look like that. So it is very conservative. Harm reduction appears only in the context of treatment, actually. So it's very, very much sobriety or abstinence focused, and harm reduction is used as a kind of auxiliary measure that is supposed to help still on the way to abstinence. So harm reduction is included in the strategy in the context that for those people who are unable or unwilling to try to go to abstinence-based treatment whatsoever, then temporarily the harm reduction measures can be implemented, but also with the ultimate goal. So it goes against all principles of harm reduction, which is based on the notion that we don't expect anyone to quit using any kind of substance, if we talk about it in the substance use context. In Poland, on the other hand, it's been difficult over the last 20, 30 years. The number of services is not sufficient to cover the needs. There hasn't been such a drastic change like in case of Hungary, because in case of Hungary there was like the drug policy and all the kind of indicators that are relevant from the point of view of international guidelines, etc. They were really going up until 2010, and then there were 2 points when they drastically dropped. So, for example, the number of needles distributed per person per year, or number of clients in services, etc. In Poland, it's been more or less stable without very significant developments in a positive direction, let's say, and without this kind of crisis as it took place in Hungary. But the end result is more or less the same. That in case of harm reduction services, it's absolutely insufficient. But also when we talk about addiction services, so treatment and in general mental health care. In Poland is pretty much non-existent. I mean, in public healthcare system, there are years to wait in line for a psychiatrist visit. In case of young people and children, the situation is even more critical, and it is even more deteriorated by the fact that the mental health in general deteriorates. So we have more suicides or suicidal attempts, and at really young children, among really young children, 7, 8, 9 years old sometimes, and 6 years olds who are diagnosed with depression. Which, okay, I wasn't a kid that long ago, but it's really difficult for me kind of to imagine how. So what has to happen and how it has to happen that a 7-year-old ends up with depression and attempting suicide. So I wouldn't say the situation is very good, not at all. But that's not only with drug policy or addiction policy. That's in general healthcare, and especially mental health care.
I think it's pretty similar in the Czech Republic as well. Like just a couple of months ago, one of the very few mental health hospitals specialized in children and young people was nearly closed due to insufficient number of psychiatrists with this specialization. At the very last moment, the ministry was able to find, but it's like obviously very temporary change. Once one of the doctors goes to maternity leave or something like that, we will be where we were before. So, why do you think it's such unattractive area? Is it due insufficient incentives from the government? Should the government spend more money in this area, or send there more people and more visibility, let's say even media visibility?
Money is for sure a thing. I think that both Hungary and Poland spend much lower proportion of their GDP on healthcare in general than the European Union average. Mental health, in psychiatrist is one of the least attractive and worst paid specializations, medical specializations. And among psychiatrists, the addiction treatment is again one of the least, if not the least attractive specialization. Also, I think the education itself, right? So you have here at Charles University Department of Addictology. I'm not sure. I don't think that there is something similar in Poland or in Hungary at any university that deals specifically with this area. I think it may be simply difficult. I mean, emotionally, psychologically, it's certainly difficult to deal with mental health issues, especially among youth. So I think that may be one of the reasons. Definitely money, because this is really psychiatrist, and within its addictology is the worst paid specialization that can be there, and also it has the least kind of respect in the professional prestige in the professional environment. But there can be also cultural factors, you know. I don't know to what extent that is kind of proven, or to what extent is kind of my intuition only and some idea, and to what extent it can be true. But I could imagine also that that this kind of taboo around mental health in general, that especially among men, that is seen, like depression is seen as weakness, or going to psychologist or psychiatrist is seen as a sign of weakness, or being unable to deal with your own problems, and having this kind of pressure of getting yourself together on your own. Maybe that's a thing. That's a thing as well, that simply discourages people to get involved in that area. And also discourages policymakers to take appropriate care of it.
I do think that the way how addictions are dealt with in Hungary and Poland was influenced by EU in the last 16, 17 years, since we both we all joined.
I don't think so. Since joining the EU, definitely the national drug strategies refer to the European Union drug strategy and action plan. But as it is visible, for example, on the example of the last Hungarian drug strategy, they refer to these different key concepts like harm reduction, different principles of the European Union, but in practice, something completely else is done. So there needs to be certain principles, certain aspects need to be covered in the strategies, but the national ones. But it doesn't really affect that much the actual implementation on the ground. In Poland, what has changed was a couple of years ago, some money from the tax on gambling was moved to treat addictions, and this has improved the funding situation of different organizations a bit. But that's also not related to the influence of the European Union. It's just that somebody had this idea. But Poland doesn't even have a specific drug strategy anymore. I think since 2016, there is the National Program for Health, and addictions are included there as one of the chapters and treated very, very superficially.
So we spent quite some time with critique. You think there is something that could be described as best practice or good examples that could be like replicated elsewhere?
I'm afraid not.
Okay, then. So, well, do you think that maybe more involvement of EU in this area would be helpful? Should EU try to, while knowing how limited are EU powers in healthcare, but should EU try to, or European Commission should try to push this area, or the importance of this area a bit more?
I think yes, but also again in the more general context of mental health, I believe, because this is crucial also. You know, when we talk about addiction, we cannot talk only about different substances. When we, especially in the context of youth, I think that social media is the biggest risk nowadays, in fact, because also it is not perceived. So when we hear drugs, we are, oh my God, drugs, so bad. But when we hear Facebook or Instagram or TikTok, there is no kind of alarm taking off in people's head. And that's why especially I think that's
when I see TikTok, there is very strong alarm, but I know what to talk.
Yeah, but that's I think that's rather an exception than the rule. But I think that so the framework that exists in Poland and in Hungary, they allow, so it's not that effective or efficient or good working services cannot be there. They can be there. The problem is that there is no money for it. Okay, because there is this framework that is maybe at some during some periods it's more favorable for certain solutions like harm reduction. In certain times it's less favorable for this kind of solutions, but it doesn't actually influence that much what can be done on the ground. What influences it is basically money. Okay, so if there is no budget for this kind of services, then there will be no services, because unfortunately these kind of interventions are funded by the states, and we talk about political will here, and we talk about different priorities that influence what's going on. With the respect to the European Union or the European Commission, what I think could be done is to promote more involvement of service providers, of civil society organizations in policy making, because their expertise, they have great expertise. They work directly with people who use drugs. They are experts, they are professionals, and they have first-hand knowledge from their clients and from the front line, let's say. And this expertise is not being used in policy making. And I think it's a huge loss. And also that results in a situation where the level of adequacy of different interventions and services and policy solutions is not satisfactory. So if that expertise would have been used in policy making, that could result in much better adjusted services that are better adjusted to the needs of the target populations. And also, since funding is the main problem, creating some kind of funding mechanisms, especially in countries where there is a kind of crisis-like situation, could be also a solution. So not only promote involvement of experts in civil society in policymaking, but also ensure that in countries where, for example, governments are against or kind of opposing to some extent different solutions that were proved to be effective in the area of drug policy, when governments, national or local governments, are opposing it and not funding it, to ensure that some funding can be acquired at the EU level.
In many previous episodes of this podcast, we discussed with our guests Europe's Beating Cancer Plan, and quite a few times there was some critique that this plan does not really consider harm reduction approach too much and does not evaluate it greatly. So my question is, do you think that, let's say, larger involvement of EC would mean more effort towards harm reduction approaches?
I'm not sure about it. I mean, so I've taken a look at this plan, and there is indeed no harm reduction approach. This is just focus on protecting youth from the negative consequences of nicotine or tobacco use. So the question
but at the same time, quite a lot of youth are actually using alcohol, tobacco, etc. So
yes.
Then you must the only answer is not zero tolerance or not.
No. I do believe. But your question was about the more involvement of the European Commission.
Yeah, whether it might mean more more friendly approach to harm reduction, or?
I'm not quite sure about it. I'll just get back to my experience with the European Union drug strategy last year, because the old one was finished in 2020 and the new one was drafted last year. We actually, as civil society organizations in the Civil Society Forum on Drugs, we've advocated at the European Commission that the harm reduction gets separate chapter, not be included within demand reduction section of the strategy, because demand reduction and harm reduction are two different things. And it was, again, the initiative of civil society. So I wouldn't say that the European Commission is a huge advocate of harm reduction policies. I think it also depends on what kind of other stakeholders are around it and how they can influence or advocate for including harm reduction in the documents of the European Commission. I think that in general, what we can see in Europe and also in the world nowadays is kind of a wave of rising conservatism and especially also since 9/11, increased security measures, control, surveillance, and so. But I think that these are also kind of like normal waves in the development of societies and in the political landscape. That we have periods when the approach is more liberal or democratic, social democratic. We have approaches. We have periods when we have more conservative governments, etc. But no, I wouldn't say the European Commission as such is a huge advocate for harm reduction based policies. I think that it obviously depends also on the specific Directorate General, but this kind of in drug policy, for example, there is still very strong focus on security measures and seeing this problem as a problem of law and order and criminal justice and national security rather than health.
Mm-hmm. Do you think it's different in European Parliament, or it's just the same? Because there are quite a few, at least nominally liberal MEPs or groups, so one would hope that it might be a bit more optimistic in EP.
Well, I think that what is a problem in this area is that there is a need for education of MEPs in harm reduction and in drug policy in more general. This is something that we've done with the Civil Society Forum on Drugs as well, organized briefings and meetings with MEPs to kind of try to create a network of MEPs who would support and advocate for more harm reduction, public health, human rights based drug policies within the parliament. So there is a group of such MEPs who are eager to get involved in that kind of activity. But I wouldn't say that is characteristic for the entire parliament. I think that, again, drug policy is an area that is very, very unattractive from the political point of view. And many people, I think, just don't have knowledge about it. So if you don't know what harm reduction is in the first place, then it's difficult to say whether you would support it or not, right? So I think that what we have to do for now is just to kind of advocate and educate and raise awareness, and then we will see what can be done. But probably I would say that it's kind of like too early in terms of awareness raising to answer your question with certainty.
Well, you didn't have very kind words towards Hungarian and Polish policies. No. But do you think there are countries in EU where it is much better, where we could bring some inspiration?
Certainly. Portugal decriminalized possession, use of any substances in 2001. Everything, of course, it's not ideal, it's not perfect either, but
it never is.
Of course, there is always room for improvement, regardless of what kind of policy field we are talking about, obviously. Czech Republic.
Thank you so much.
That's true. In the region,
Yep.
Czech Republic deals with addiction and with reducing harms and risks the best, in a way that your indicators on, for example, coverage of the target population by substitution services, by needle exchange services, are just the best in the region. The network of services that you have, the geographical distribution. I've analyzed it at some point. You have around 100 low threshold services for people who use drugs. This is and let's look at the size of the country. Okay, in Poland, I think it's not more than 20. Okay. So yes, there are, but also the money here is completely different. The approach is different. Also, what I mean is that the criminalization of possession of small quantities a couple of years ago. So there are good examples to learn from. Absolutely. Also there are differences in how services function, right? When because I do research for several years as well, and when I ask about capacity of organization or of employees in low threshold services, for example, well, in every country they will tell you, okay, that our capacity is very limited. But what it meant for people from one organization in Czech Republic that their capacity is limited was that they would like to accept more clients, but they cannot do it, but they are still open 365 days in a year. What it meant for Slovak organization that is based in Bratislava, that they have limited capacity, meant that their service was open 3 times a week for 4 hours per day. Okay, so obviously there are differences, but this is all about having a person who at the decision making level, who is willing to support certain solutions and money.
Let's talk for a moment about youth organizations for drug addiction, where you are vice president. My apologies for the mistake at the beginning. So what is it all about?
It is a network actually that brings together organizations working with youth who use drugs in 20 plus European countries. It started several years ago. We've, in the beginning, had Poland and several Balkan countries. The function of YODA is basically to empower, okay, and to build capacity. So we've noticed that there are many organizations where youth works, and many organizations that work for youth in many countries, but their voice taken separately is not as strong as when we put this together. Okay, so we thought that through creating, or Jan, my friend and colleague who was the founder of YODA, thought that through creating such a network we can amplify the voice of the youth at the international level. So for the first several years were around sending delegations to the annual sessions of the United Nations Commission on Narcotic Drugs that takes place in Vienna, and give the possibility to these young people from different countries to meet with the representatives of their countries at the UN CND, which is an opportunity that they may not have anywhere else because they are just not in the same room ever, except this one occasion. So that was what we've been doing, and ever since we've also organized many trainings where different organizations from different countries meet, share their experiences, we write recommendations, we organize trainings facilitated, but external experts as well. So given that this network also has the possibility to apply, for example, for the European funds, for the European Commission's funds, that would be impossible for each single organizations to do. We try to use that to build the capacity and to amplify the voice of these youth organizations in different countries.
Do the politicians listen to what you have to say? When you mentioned the recommendations, I think any level, European or nation states at all.
I think that it's rather civil servants who are more eager to listen. People who deal with this policy area in specific agency or ministry, rather than parliamentarians or representatives in the parliament.
I guess for the voters it's more attractive to say no, just zero tolerance, etc.
I think so. So. That all depends on how the society probably and how the public opinion looks at this problem. Politicians probably will say anything just to win the elections. So if the kind of atmosphere in the society is like, no, this is pure evil and we should ban it, then they will do that. Do they listen? It's difficult to say. I think it's very, very much based at the individual level. So that also is something that actually comes up many times when you talk about the situation with service providers but not only in the region, in any country. That very much of what are the possibilities and what organizations can do. It to a very large extent depends on having a person at this level where the policy is implemented normally. So again, civil servants rather than politicians, and if there is such a person who is eager, who is supportive, then it's okay. But that's not kind of institutional thing, but an individual one, and depending on the attitudes of a single person who we don't know how much time will be in the office and who will replace them if they are removed or if they leave. So from that point of view, this is not very stable or sustainable. Yes, and going back to your question, if they listen, that depends on a person, I guess.
Well, let's make a very large step back to very, very, very basis. What are actually the specifics when we are talking about addictions and young people? Is it much different than the, let's say, general population?
I think that, like in the context of illicit substances, of drugs, I wouldn't actually. I mean, I'm not trying to say that addiction or dependence doesn't exist among youth, but it's minimal. And when it exists, then it is mostly, and this is also something that is based on the data that are collected by the European Monitoring Center for Drugs and Drug Addiction, that high risk use or drug dependency among youth is very strongly concentrated among young people who are deprived or vulnerable due to some factors. For example, their social economic status, etc., etc. Okay, so if someone comes from the deprived background, there is much higher probability that there may be high risk substance use or dependency. But I think that in general among young people we rather should talk about substance use than addiction, because this problem with addiction is really minimal in terms of the ratio, okay, or proportion. So, and when we talk about substance use, actually, then but also in terms of adults, if we talk only about addiction, we also give the message to the society that any kind of substance use is always related to addiction. This is not true. Actually, dependency is maybe 10% of all substance use. Majority of people use alcohol as well without it becoming a problem after a certain time. Okay, so I think that talking about dependency is important, but also I believe that talking about use as such, without judgment, without demonizing, with harm reduction approach, but also not only harm reduction, but also benefit maximization. Okay, so what is important is also that we don't discuss, so we only focus on this negative side, okay, or have been focusing for decades. But there is some reason why people use drugs in the first place, right? We don't talk about pleasure enough. We don't talk about the benefits that people have. They don't use it because of the possible negative consequences. They use it because they get something out of it, right? And we don't talk about this enough, I believe. This is starting to change.
That's brilliant point, yeah.
But
that's a brilliant point. And actually, you are the first one who mentions it here. And this is like, I think, 5th episode when we are discussing addictions. So that's
yeah, I think that this is the point. This is also kind of this is the point that is being made by people who use drugs, by users' unions to a large extent, and by the youth organizations. Okay, because really, when we think about it from the logical point of view, you don't engage in activities that are only harmful, right? They may occur to be harmful after several years if you don't have maybe sufficient social network, or if you try to cope with your mental health issues or your problems using substances, then it may turn out to be risky and harmful. But in the first place, you get something out of it that benefits you, right? And that's why you engage in that activity. So I think that just to very shortly sum up and come back to your question, I don't think that there are huge differences between addiction or dependency between youth and adults. The only main difference that I would see ad hoc would be that their personalities are still developing. So from that point of view, they're probably more vulnerable. But the mechanism is more or less the same. Okay, so if they have sound health, mental health, also social network, family support, etc., and they use substances to have fun and not to cope with stresses or reality whatsoever, then there is a really, really low likelihood that their use will become problematic or high risk. And this is the same for adults as well.
Okay. Let's imagine if you were to become a Hungarian health minister tomorrow. So what would you implement in ideal world?
In drug policy?
In drug policy.
Well, I think that first of all, good drug education, because prevention is problematic. Drug prevention is problematic all over Europe. There is not enough money for it, and it's not being done properly. So, honest, non-judgmental, open education and talking with kids about different drugs, about substance use, not in a way that policemen with a dog come to the school, but drug education that also is respectful. Okay, so doesn't treat kids like idiots who don't have access to internet and cannot check anything on their own, but being simply honest. So that's I think this is extremely important. As a Minister of Health, I wouldn't have such powers, but I would definitely advise the Parliament to decriminalize people who use drugs, meaning that they would decriminalize possession and use. In Hungary, use of illegal substances is also criminalized. So use and possession of illegal substances. More money for healthcare in general, definitely, and more involvement of experts that are working in the field instead of politicians for whom it's the only profession actually, and who maybe not always have sufficient knowledge in what they decide on.
Okay, so thank you so much for coming. Thank you for your time.
Thank you
it
for
was
having
great.
me.